All right, so we have our beautiful model here, and her cheekbones are natural. You guys, let's just take a moment to appreciate that. That is all natural, phenomenal cheekbones she has. And then that jawline, gorgeous bone structure, which is going to help her so that way she ages really well, right? But a lot of times when we have that amazing anatomy, it's the transition areas that need a little bit of love. And so in her case, that's exactly what it is. It's this transition area here in her temples that we're going to treat today. She could also use a little tiny bit back here in her preauricular area at some point, just to soften that and to help support that skin and kind of give her a little pull back here. But today we're going to do temples. We haven't done temples yet, so that's today's adventures. And she is, I don't know if we're going to do one per side and just do the one up, one over, or if she's going to need that second one to kind of blend it. We'll see. So I told her we'll plan on 2, possibly 3. We're just going to kind of play it by ear and see what it looks like and go from there. So let's talk about the anatomy first. So the anatomy of the temple, probably see this side better. Anatomy of the temple. You have your orbital retaining ligament, which comes around, and that actually comes all the way around the eye. And so you can feel that orbital bone, and it's just right on top of that orbital bone. Then you have your temporal, superior temporal ligament, which this one can be tricky to find on people. Sometimes you have to really feel, and what you're looking for is that temporal bone and the frontal bone and that fusion point between the two. Because the temporalis muscle is going to be on the temporal portion, and then the frontalis is going to be on the other side. So different ways that you can find this is have them lift up their brows really high, and you can see where that movement is, right? And then you can have them bite down and clench, and see if you can see the muscle clench up at all. On her, I can't really see it. And then the other way that you can do is you can just fill. And what I'm filling for is I want to fill, it's almost, I feel like a curve, where I can feel the orbital bone on one side, and then I'm looking for that frontalis bone. So where's my finger hitting that fusion point? And I'd say it's right there. So right here, I can feel these two bones connecting together. Then you have your inferior temporal ligament as well. So you have this compartment here, and it's actually a huge space. If she were to bite down and I were to feel back here in her hairline, I would feel her temporalis muscle as well. So you have this huge cavity in throughout here. There's different ways to treat this. You can use Sculptra. You can turn that. You can use Sculptra. You can use filler. We're going to do filler today for a different perspective. We'll do Sculptra another time. That way you guys can see that. But honestly, the technique is exactly the same. So I don't do anything different for them. So we will do that filler today. But think about volume. When you're doing volume on something like this, it is tiny. I mean, even though it's a full syringe of filler we're putting in there, a full syringe is about the size of a blueberry. So it's a very, very small amount of product. And if you're thinking about that whole cavity, right, that we have, a little blueberry in that whole cavity is not very much, right? So that's why we may need a little bit more. And I'm thinking also more to transition from here up. So I'm confident that that one syringe is going to help with this hollowing here. But here, this transition, just because she does have these phenomenal cheekbones, that maybe that transition up may need a little bit just to soften that. We'll see when we get there. So once you found your landmarks and you're confident that that's where they are, and like I said, sometimes that's the hardest point, is just really locating that and feeling it and feeling confident in it. You can also have them open their mouth really wide open, and sometimes that will hollow them out even more. So play with it. Kind of see how you can locate those landmarks and feel comfortable with it. The next thing you're going to do is you're going to pause, and you're going to feel for arterial pulse, right? So usually the artery's back in the hairline, but sometimes it'll be more superficial. So you get your fingers, and you're just going to pause and make sure they aren't chewing gum or anything, and you're just going to feel. And actually, I can feel an arterial pulse on that side, so I'm going to bend around and see. And she's had Sculptra here in the past through the wire, and you can see a little nodule from where she's had that done. So she's a little hesitant to so don't blame her. Yeah, so she has a little tiny vein right here, and I think that's what I'm feeling. Because typically, let me see if I can pull it back here. Your artery's back here in your hairline. So if they have a pulse there and you can feel it, what do? Just avoid it, right? Go somewhere else. Just say, all right, that's where it is. I'm not going to inject there. And she does have a vein coming across here, so I'm going to inject a little bit lower on her. So more about there. Typically, the 1 up, 1 over is 1 centimeter up, 1 centimeter over. I actually don't understand that terminology at all because in my brain, I guess maybe if you're laying down, it's 1 up, 1 over. But in my brain, it's 1 down, 1 back. But that's just the way my brain works. So 1 centimeter from each of those landmarks is where you should be going. Supraperiosteal is where your injection point is. So we'll just make sure that we avoid where I can feel that little pulse. I'm going to go down a little bit inferior to that. And we'll inject this. We're going to clean her off first. And then we need to draw on this side. I need to fill my landmarks on this side. On this side, I can honestly almost even see right there where she's got that hollowing, her orbital bone, and then bite down for me. So if you hold your finger on there where they bite down, then you can usually feel that muscle kind of pop up. And then 1 up, 1 over would be about right there. So 1 centimeter up, 1 centimeter over. And feeling for a pulse. Yeah, I didn't feel anything when I was feeling both of them on this side either. So we're going to start on this side.
Does that mean I'm dead?
That means that your body's cooperating with me and not putting a pulse right where I want to go. So thank you on this side. All right. So other tips. If they are biting down when you're doing this, it's going to hurt them more because those are your muscles, your chewing muscles, right? And so if you're clenching, then you're clenching that muscle, and now I'm poking a needle through a clenched muscle.
Okay.
So I like to have them relax, like separate their teeth and just relax while that needle's going in, and then it's just a very slow push. Also, I like to warn them that tomorrow they're going to be a little bit tender because I just poked a muscle through their chewing muscles, right? Mm-hmm. So anytime that, like tomorrow, you're going to probably want to eat softer foods, like not your salad, not your steak, right? Like just softer foods.
Okay.
Will be more comfortable for you. And then I'm going to give this to you.
Okay.
And you can put it on your jaw, your chin. Now, I like bevel down because we're filling here, but we have this entire area that we're trying to create volume to. And I have these ligaments. It's not going to allow it to come up onto her forehead. It's not going to allow it to come over to her orbital. And then we have this one down here, your inferior temporal ligament. So it really is filling in there. That way it just is flooding down. That's the way I like to do it. So bevel down and then turn a little bit. Yeah,
is that good?
Yep. And then I'm just looking for any superficial little veins that I can see. I don't see any right there. So that's where we're going to go. So I'm going to go in, little poke, 1, 2, 3. Really good aspiration here. Really stable. Aspirating, and you're just going to hold it. Be patient. And then when I'm going to push, I'm actually going to keep my finger here against her eye and keep pressure there. Now she has her orbital retaining ligament. I know I'm blocking the camera, but you'll see it on the other side. She has her orbital retaining ligament. So I'm not necessarily worried about that filler going towards her eye, but this is just now one more cautionary thing I can do to help prevent it. Nice slow push. And I'm actually seeing a result already. And I was like, I have gauze on hand. She didn't bleed at all, but I can't tell you how many times that after I pushed a pull syringe and then you pull out, because of the pressure, just a big gush of blood will come down. So I always like to have gauze on hand just in case. But, and that looked so nice. So good. So good. I'm going to have you take a look. And when I was filling it, I was going really slow. I wanted to make sure that it was not too much pressure, that it was going to backflow into maybe a vein I went through. But also, I started seeing it right away. So I was really starting to look and make sure I made sure I was super periosteal, that I was where I was supposed to, but also that I wasn't seeing it coming up anywhere. Because there's a chance that if you are up beyond that ligament, then you're really on the frontalis. And so then you will start seeing it up here. So I was just slowly pushing and watching to make sure it was not looking weird. And then as soon as I was done, it looked a little bit over full, but as soon as I pushed on it, it just went right into that cavity, and now it looks amazing.
I could kind of see it in the camera. Oh my goodness.
Right?
Wow.
I mean, that's where I'm like, okay.
Wow.
And I'm going to leave this up to you. That transition's pretty nice now. I still see a slight hollowing here. Tiny.
Just a little bit though.
So if you wanted to, we could even just do another half syringe.
Okay.
Split between both.
Okay.
To finalize it. But if you're like, I'm happy with that, then I am too. It's more up to you. We'll do the other side.
Yeah, let's do the other side and see, because I think this side is a little bit more hollow.
Yeah, back further too.
Yeah. Wow.
Oh.
But it's such an easy, I mean, the whole treatment maybe takes 15 minutes. So it's an easy treatment to be able to get a nice result.
Yeah.
The results are going to last about 1 to 2 years, which is nice. One thing to consider too is she didn't have a huge response when she bit down on her masseters, right? Or not her masseters, I'm sorry, her temporalis muscle. I didn't see a huge bulge. If there's somebody who, when they bite down, their temporalis muscle bulges out, be cautious in injecting too much here or any at all, because every time they bite or chew, then now it's going to be bulging out even more because you just added volume. But when she bit down, she didn't have a huge response. And so that told me she could handle it, right? But now when she bite down, now I'm starting to see it there, right? Just a little bit. Still doesn't look crazy. Where I'm not seeing it is right here, which is that transition point we were talking about. Okay. So I think you could handle it. It's more aesthetically.
More aesthetically, okay.
All right, let's see where these, oh yeah, I can see your purple one. Your pretty purple one. And then I can see another one right
It's a pretty
there.
blatant, like right there. Yeah.
Then you have another one as well that you can't see really well. I think that one's actually the one that's pulsing, is the one you can't see.
Mm. Now, how does this impact with, though I shouldn't touch it, but with the
nodule?
Yeah.
I'm injecting deep.
Okay.
So your nodule is on that surface of the skin.
So is it going to make it more obvious?
It might a little bit.
Okay.
Yeah, it may a little bit. Now, things you can do for that, if it's bothering you and you want it gone, and you're like, that's making me
I've
insane.
tried.
Have you done a steroid injection?
No, have not done that.
So that would be an option.
Okay.
There's risks associated with it. So when you have a lump out, it's too much collagen that's been formed in one area. So you can do a steroid injection, which I would go extremely slow on you, like baby amounts. The risk is it then causes a divot because what it's doing is it's atrophying or essentially killing the fat cells in that area along with the collagen in that area, right? So it's just kind of killing all of it right there, which then you risk having a little deficit. Okay. So it's like...
It's kind of half catch-22.
Yeah, so that's why really slow, like tiny, because I can always add more.
Okay.
Can't take it out, right?
Well, let's just, maybe it won't be as bad as,
And it may not. You may actually be like, oh, that doesn't bother
Can't
me
even
at all.
notice. Yeah.
It actually came a little low for that Sculptra. I usually come up higher, but they probably were trying to avoid this lovely vein thing you've got going over here. I'll have to edit this part out as I sit here and like carefully show where there it is. Okay, so it's a little bit back. I just want to make sure I'm nowhere close to that pulsing artery. Okay, same thing on this side. So I really can feel her pulse a little bit further back. So I'm going to come a little bit more anterior. And then I almost can see right there where it is as well. So a little poke. Make sure you aren't biting down. Bevels down. 1, 2, 3. Aspirating. This is where I just pause. I'm not in any hurry. And I did not prime my needle. So my hub, I had product up to the hub, but not my needle. So theoretically, if I were in a vessel, it would be easier to see. Keeping that there, and then I'm going to keep that pressure on her eye bone and start pushing. And again, just a nice, even push. Not in any huge hurry here. And just watching the tissue, watching the response, making sure I don't see anything that's alarming. Alarming being, it's bulging up unexpectedly, or a really quick response. That I feel like I'm in the wrong place. Maybe I'm too superficial. Maybe I'm really not super periosteal. Alarming being that tissue blanching at all, anything like that. So I'm just watching. I'm not even really watching my plunger at all. Every once in a while I'll glance at it just to see where I'm at, but I'm watching the tissue and everything else that's going on. Almost done. And another no bleeder. Well done. Nice. Cooperated so nicely with me, even though you had veins all over there. Okay, so gentle little push, massage. Okay, so nice. Yeah, I don't think you can see that nodule anymore. In fact, it maybe is camouflaged a little bit. All right, take a look. You can know what you think.
Oh my gosh, what a huge difference.
Mm-hmm.
Wow.
So then it's really just, I can see, this is where I'll point out where I can see, and you can decide if you're like, yeah, let's do it.
Or you tell me from the aesthetic standpoint, because it's...
So I see a little bit more hollowing back here on this side, just slightly though. Like not much, it's not crazy. And then on this side, I actually see it more.
Down there.
Right here.
Okay.
So we could do, I was going to do a full syringe. I wouldn't on you. I just don't think you need it.
Just
I think I'd probably just do a half.
Okay.
And just split the half
on
between both sides.
Okay.
I trust you. It would be completely done, and I don't think you'd need any more. This side, you have a little bit of hollowing right here. I may place a tiny dot right there too. Do you see that?
Mm-hmm. Yeah.
Just slightly. Where on this side,
it's not quite as much. It's it's more obvious on my left side.
We all have asymmetry side by side. That's normal. So just correct those little asymmetries. Okay. We'll do that other little half. I'm going to switch my products.
Cool.
So we're going to do a little bit of filler with the temples. And I don't love really any of the fillers superficial in the temples because I feel like they can get a little bit bumpy and lumpy unless I dilute them a little bit. So what I'm going to do is I have eyelite. She doesn't need much. Normally I would do a full syringe and then I would dilute it with 1 ml of saline. So she's still getting her full syringe of filler. We're just making it thinner. But in her case, she doesn't need that much. So I'm going to do a half a syringe with a half a cc of saline. And we're just going to blend the two together. That way I'm not worried about her getting lumps and bumps in this area. I'm not worried about it looking strange. I've seen it where it even looks kind of wormy, where it looks like, you placed it superficially and that tissue, it looks like worms are under the skin. It just is not a great look in the temples. So I'm prepping it. You put the syringe on, you prime it, so that way you don't have air in there. Then you can get your saline, make sure it's primed as well. Then when you put the two together, you aren't going to get a bunch of air bubbles because now there's product all the way throughout there. And then I'm just going to squirt it into each other and blend it. So now I've made that filler more liquid, more thin. So as I'm filling, I'm able to place it and know that half of that is water or saline and will get absorbed into the skin, and what's left behind will be a nice even distribution of the product. And I feel like this gives a much more beautiful, even application when you're superficial. Do you have to do this? No. Are there lots of people who just go in there and put it? Yes. I just like it better. We're going to use cannula. So what layer am I injecting in? It's going to be layer 4. So 4th layer. So we've numbed her. She's not really blanching that much though. Let me see on this side. That side's better. Okay, so we've numbed her with a little bit of Lido with Epi in both of her cheekbones. Now, layers that you can inject in here. You can inject just under the dermis, so layer 2, right? You have your skin and then the layer under that. That's how I have done it that way. It works. I definitely like to do that blended product if I'm going to be injecting there, because that's where I feel like you really can see the product laying weird if it's too much or too thick of a product. And so I definitely, if you're going to go in that layer, I highly recommend diluting it 1-to-1. I'm going to be going a little bit deeper, so I go down super periosteal and then glide across, and so I'm about layer 4. So I'm under, and I feel like that one is a little bit better because you don't see the product so much. You see the benefit of the product, but you don't see the strangeness of the product. So I go down super periosteal on the cheekbone, and then I'll glide up and just treat right in this area all the way across. I'm using Eyelight, Restylane L, same thing. The reason I chose that is because it's a half cc. That's all we're going to use, so it worked out perfect. Other products that you could use though, Restylane L, Silk would probably be my next 2 choices. Restylane L is, like I said, the exact same thing. It's just a full cc, which she doesn't need. All right, little poke. A lot of people will go down super periosteal with their pilot hole. I don't. I feel like I can get down just fine without causing more damage and more risk of hitting a blood vessel. So super periosteal, I can feel, feels like it's right on that countertop. And now I'm just going to glide up, and I'm going to see where it's going to let me go in without any additional pressure. So I warned her that, she may feel a little discomfort, a little pulls and tugs here, but for me, this is where I'm just like, I will wait and figure out where it'll let me go without me pushing any harder than what I am right here, because I don't like the idea of forcing anything in this area. And then we're just going to place a little bit, and you can see. Now here's what's nice too, is because it has that saline in there, I have a higher margin of error, right? Because half of it's just saline. So if it's a little more than I would like, that is okay, because half of it's going to go away when I'm done, because it's just water. How are you doing?
I'm good.
A little bit higher and a little bit further back. This also can make any artificial little veins really stick out for a little while. I tell my patients it's not going to stay that way, but for a little while it may look like, they've got some crazy vein thing going on. Got such good cheekbones, it's hard to grab. Here we go. And right there, you can almost see that ligament, and that's what I'm getting hung up on, that line right there, which is fine. There's an opening somewhere right there. See, it just let me through, and I didn't have to push any harder. I just tapped and tried to see where is it going to let me go through without any more force. In this area, this is not an area I want to force. I mean, look at all these lovely veins. That is the last thing I want to do is be forceful in this area. So I just patiently will tap and see where it's going to let me go. She also has a little bit of hollowing right here beside her eye. I'm going to just touch a little bit. just a tiny bit. Smooth that transition from her temple nail to her cheek and her eye. Okay. Like I said, half of that will go away because it's just water. Shouldn't even feel this because you're nice and white right there where I numbed you. So that little tiny numbing spot is white. That's just from the numbing. Remember how we talked about watching for that? That'll go in like an hour or two.
Okay.
Because what it is it's lidocaine with epinephrine, and epinephrine constricts the blood vessels, which is what turns it white, which is what we don't want to see with filler, but with the numbing. I know where it is. I know it's there before I even started. That's how I knew this side was numb and that side wasn't, because I could see the white here and I couldn't see it over there. So it usually, like I said, lasts about 1 to 2 hours.
Okay.
And then it goes away. All right, same thing on this side. Pink and skin. Wanting to.
It's not wanting to do it.
I'll get him. I just make sure I made my hole. I'll make the skin. Sometimes I get moving too quick and then it's like, wait, wasn't ready. Not quite ready. Okay, so again, I'm going to pinch up that cheekbone, and then glide up. And when I'm on that cheekbone, I want to make sure I don't feel any tissue on top of it, that it truly is a cannula right on top. And now it'll let me glide right past. I must have found a lucky spot. So overfilling just a hair, knowing that half of it is water. So a little bit more than what you think is okay. If you're ever questioning if you came off that spot, just go back to your reset point. Check and see that ligament grabbing there. So now I'm just going to see if I can find a way to gently go past it. Where's a little opening? I'm just making little micro adjustments. Well, there it went. So our ligaments are not like a full sheath. They usually have little gaps in it. So you're just trying to find that little gap. Okay, turn towards me a little bit. Come right here. And this little hollow by her. I make that transition a little bit smoother from temple, cheekbone, and eye down. Just filled right up. That was pretty. So now that I'm out of your face, I'm going to tell them a story.
Okay.
So when I first was taught cannula, I was taught to get to where you want to go to twist it. Kind of like almost you're screwing it, right, into the face. And so that's what I did. I was like, all right, get in there and I'll twist it into the space. And I'm treating somebody's, I think it was their mid-face, I treat their whole cheek area, doing that kind of a technique. And then I'm ready to come out. And I try to come out, and I can't. It's stuck.
Jeez.
And so instead of like freaking out, right, I'm like just talking to the patient. In my head, I'm freaking out because I'm like, oh my gosh, I can't get this out of her face. And I'm thinking, I'm going to have to send her to plastics, with something stuck in her face, and they're gonna have to figure out how to get this out. And I don't know how to get this out because I'm like trying and I'm moving it, and I'm like, it is not coming out. It's not coming out. And then I had the thought, okay, when I twist, I always twist to the right. So I'm gonna try twisting it to the left and see what happens. And I twisted it to the left and it came right out.
Oh, geez.
So I think I had gotten something
Like
stuck on it, like a little bit of tissue from twisting. And so from that point on, I was like, I am never twisting again. There has to be a better way to do this. So that's when I came up with my little knocking. Now, when I've taught people, I've seen people where they knock like this, and I'm like, that's causing a lot of unnecessary trauma. Like, you do not need to be aggressive. It's tapping, right? So when I get stuck, let's say this is my ligament or whatever, and I'm getting stuck on here, instead of going like this and all I'm doing is trying to break through it, is I just will sit here and I'll go like this, and I just tap, and I'm like, oh, there, it let me go through. And so be gentle. A cannula is only safer if you are gentle at using it. If you're aggressive at using it, it's no different than a needle. In fact, it probably could cause more trauma because you're just crash coursing through everything. So be very, very gentle, very careful, and making sure that it's not a lot of pressure. I mean, you can see that it's just barely gliding. I'm not jabbing it into their face. And I don't twist anymore because that's a bad idea. So check out those temples. That looks so good. The veins get a little bit angry temporarily.
Okay.
You see how they're just kind of
Yep.
bulging out? That'll
Yep.
go away. They're just ticked off because I was jabbing at them.
Wow, it looks a lot better.
Right?
Oh my goodness.
Just so smooth.
It looks a lot better.
No, it looks so good. So
Thank
I
you.
would expect these results to last her a good 1 to 2 years. Now bite down for me. And you can see it's not bulging out crazy. This is a little bit full here, but I knew that going in because it's half water. So it will chill out a little bit and be a little bit smoother. But I think in the end, once that settles, it's going to be gorgeous. All right, good job.